We run the sessions 3 times a year, and they're a 2-hour session which we hold in a local community centre. We thought it was better not to hold them in the hospital. So, and to do this, we've had some help financially with the Cancer Rehab Project, which is part of Macmillan. So they help provide the room and a cup of tea or coffee for the patients. We also, to run the sessions, we also have support from our skin multi-disciplinary team. So we couldn't just run the sessions on our own. So we have the CNSs are there, but also we have a plastic surgeon and a clinical psychologist as well to run the sessions. So it's a very informal, friendly session. Patients are invited. We send them an invitation and stress that it's part of their follow-up to attend, and they're welcome to bring a friend or relative with them. They come to the session. It's set out, as I said, really friendly, and they're able to get a drink before they come in. And people start talking straight away, actually, which is really nice, that sort of support side of things. The contents of the session is we do a session on how to prevent further skin cancers, sort of health promotion. And it's really interesting how many people don't really understand about what sun protection lotions do, what's the difference between UVA and UVB. So it's all sort of quite basic things, but actually things that people, you know, do need a bit more advice on, and what to look out for, what to avoid. So we do that session first, and then the plastic surgeon runs the self-examination session, so what to look for on your skin, changes with your moles, and also how to check your lymph glands. We've made some props that people can have a feel of, and they're little pillows, so people can feel what it would be like to feel their lymph, if they could feel their lymph glands. And the clinical psychologist runs the last session, which is about anxieties related to having a diagnosis of melanoma. And after that, then people can ask questions, and there's quite a lot of debate and discussion that goes on as well, which is nice. I think they feel that they've got some specialists in the room so they can ask questions. And then we get everybody to evaluate the session as well, and it's been really well evaluated. And if there are any comments that people make, we then can adapt. We've then adapted the next session accordingly. So for example, somebody was asking about how they would talk to children about their diagnosis, so that was sort of added to the next session. Someone also had a very good idea about bringing actual suntan protection bottles in so they could have a look at them. So we bring a variety in, we collect them through the year and bring them in for people to have a look at. So that's really positive.